Welcome everyone to the PsyD webinar. I'm Bradley Cipher and I'm the admissions advisor for the PsyD program here at Divine Mercy University. Joining me today is third-year doctoral student Malcolm Anderson. So the format for today's webinar will be me interviewing soon-to-be Dr. Malcolm Anderson before too long. And then we'll move into the presentation, the slideshow presentation, and I'll field participant questions at the end. So if you do have a question, please lodge your question in the chat box, and myself and Malcolm will attend to them at the end. So without further ado, Malcolm, welcome to the PsyD webinar.
Thanks, Bradley.
So Malcolm, how did you become interested in clinical psychology in the first place?
Sure. So I did my undergrad in philosophy, actually. That was where my primary interest was out of high school. And in my undergrad, was the first place I started getting interested in psychology, taking a few courses, and ended up minoring in psych. And what I really found was that psychology was an excellent avenue for a practical application of the things that I really loved about philosophy. The big questions that I was interested in, and it took that into a format of helping people very directly, and I've really found that to be true in my practical experiences so far here at the school, working with clients. So that's where my first that's kind of how I got here. That was my undergrad experience.
Great. So it sounds like you would agree with the adage, clinical psychology is sort of applied philosophy. Is that fair?
Absolutely. Absolutely.
Good. Yeah. All right. So then why did you choose Divine Mercy of all places?
Of all places, Divine Mercy is very unique in its integration, I would say, of philosophy, theology, and psychology. And through our studies here, we really learn how those three great intellectual traditions really inform one another. And we learn how to integrate philosophical principles into our clinical practice, influence at the same time our theological beliefs, and informs our understanding of the human person, which then is transferred into the clinical work. And in my research, when I was looking for graduate schools, no one was really doing anything or seemed to be offering anything quite like what is here at DMU. And I've certainly been edified in my experience so far. That's definitely been true for me.
Fantastic. So then say a bit more about your own academic and clinical interests. What, if you could have your pick of things after graduation, what would you like to end up doing?
I'm really interested in personal private practice or group practice eventually, working as a licensed clinician, seeing a weekly caseload of clients. So I just finished my second year here in the program. And a key aspect of the second year is that you actually start to apply what you're learning in the university clinic, and you start seeing a few clients a week, getting lots of supervision, lots of structure and support from the staff and the clinicians in the clinic, and I've really enjoyed that. Actually, putting the things that we're learning into practice. It's an added workload, but that has been the most enjoyable part of my week for the past year of study, is actually being in the room with clients, doing real treatment planning, practicing actual interventions, those sorts of things. So I'm certainly looking forward to, after graduation, joining a group practice or starting my own private practice, and yeah, we'll go from there.
Very good. But is there a demographic, or is there a pathology, or is there sort of an area within private practice as a clinician that you have any particular interest in or would like to pursue in a dissertation?
I'm really interested in in adolescents and families currently. And my dissertation project is studying parents in particular, and trying to determine what contributes to flourishing within the vocation of parenthood. And so next year at my next placement site, I'm looking forward to having the opportunity to practice couples counseling and possibly family counseling as well. And so that's really where my my demographic of interest is currently adolescents and adults, and particularly couples and family therapy, hopefully.
So have any of those interests been dovetailed into a dissertation that on any of those issues?
So sorry, can you restate your question?
Sure. Yeah. So it sounds like you have a number of clinical interests, which is fantastic. You mentioned marriage and family, couples therapy, the role of parents. You mentioned adolescents and their the issues that they have. But I mean, in terms of what are you thinking in terms of your dissertation?
So my dissertation, I'm currently working on the proposal right now. And initially, I was interested in the effects of technology on parenting as we become more and more a technological society, focused on our phones, on our social media, that sort of thing. And when I was looking into the literature, I really couldn't find a metric for parental flourishing, something to operationalize it in a holistic manner like we do with our understanding of the human person here at DMU. We talk about multiple dimensions of the person that we want to consider all of the as many dimensions as possible when trying to understand what contributes to flourishing. And I really couldn't find a metric in the literature that served that purpose. And so my dissertation project is going to be psychometric in nature, specifically trying to develop a measure to capture parental flourishing. So it'll be a survey tool to be administered to parents that will hopefully, ideally, give us an idea of how well they are flourishing across particular dimensions of their role as parents. And that would be ideally taken into future research to look at specific things like technology use. Or I have a colleague here who is interested in the effects of family meal times on parental flourishing. So ideally, my project would provide a tool to be used for research down the road.
That's fantastic. It's fascinating. It sounds like you found a way to kind of bring together your interest in technology, but also parenting and the role of the parents in meal times and technology and things like that. So that's fantastic. Would that qualify as an empirical dissertation or a theoretical dissertation?
It's going to be empirical. That was not my initial plan. My initial plan was to do a theoretical dissertation, and for those that may not be aware, a theoretical dissertation is going to be digging into the literature on a particular subject and expanding it into a new theoretical domain or a new application, and proposing that certain things connect or that certain things could be expanded or applied in a particular way. Whereas an empirical dissertation is we actually want to find some data on a particular thing and actually do a study and have something to show for it. And so that's going to involve a theoretical component as part of the kind of preliminary proposal for the project, why this is useful. And then it will actually be going out and getting data and seeing if running statistical analyses and seeing if we actually have something or if we need to pivot.
Sure. Great. Okay, so it sounds like you mentioned kind of anticipated, honestly, one of my questions about, because I like to ask webinar guests, what has been really the most enjoyable and rewarding part of being at DMU? And it sounds like for you, it's your new foray into the clinical world, seeing patients in the Rocky University Clinic. But I want to take it in the other direction. What, to your mind, has been like maybe the most challenging aspects of being a PsyD student here at DMU?
Sure. I think those two things are very closely linked. The unique, maybe I could touch on briefly the difference between a PsyD and a PhD program. I don't know if that's coming up.
Yeah, sure, go for it.
So as a PsyD program, what makes a PsyD program unique from a PhD program is that it's less research focused. So I am doing a dissertation, as I mentioned, but the focus is more on the clinical application and getting us into the clinic early in our academic journey, and getting as much face-to-face time and practical experience as possible. That's really where the focus is. So we want to be able to understand how to do research and how to interpret research and apply it to our clinical work, but actually doing extensive research is not as much the focus. And so with that, there's a lot of clinical work. And as I mentioned, that's been the most enjoyable part for me, and probably the most rewarding, actually applying these things. And it's kind of exciting because you've been building up to it for so long. But it's also a lot of work to have your academics alongside the clinic work. And so I would say that's probably been the most challenging aspect, even though it is the part that I enjoy the most and find the most rewarding. Just practically speaking, it can be very difficult to be, fully invested in your academics, and also, have the emotional and cognitive space to then pivot, within a day. Over the course of one day, I might have a couple classes and a couple clients, and you're going back and forth between being in class, doing some homework, working on assignments, and seeing clients at the same time. So I would say that's been the most difficult thing, but the clinic work is definitely also the most rewarding.
Yeah, well said. Word on the street, as I understand it, is that the second year is sometimes some of the most challenging year in the program, for the reason that you mentioned, namely that it's really kind of your first time where you have a full slotting of classes, but you also are seeing a couple of clients during that sort of same time space concurrently. So good.
Yeah.
That's a good answer. I liked how you kind of you see that it's both rewarding, but it's also can be very difficult to kind of do the clinic and the academic. Good. Okay. For those listening, what would you say would be some very good and sensible reasons for doing this ID? And then what would maybe be some very not so good reasons for doing doctoral work in psychology?
That's a great question. Let me think for a second. So I think good reasons for entering into the PsyD program here at DMU or graduate school in general. Number one, you have to be interested in it. If it's a lot of work, and so you have to kind of find intrinsic motivation in the work itself, and be interested in it, invested in it, in order to kind of have the perseverance to get through it, and to really get the most out of it. A desire to help people, I think, is really important. Particularly with the clinical side of things. I think anyone who's attracted to a PsyD program, that's probably a focus for them. That's probably already an area, or a reason that they're looking at this type of a program. So I'd say that's very important. As far as reasons not to get into it, that's a tough question, because I don't know. I'm here, so.
yeah. I mean, it's I get it, because it sounds like you have done it for the right reasons, so namely that you have an intrinsic interest in psychology, which is not purely speculative or academic. It's that you get to apply what you learned in the classroom in a clinical setting, and hopefully, God willing, in the future, go into private practice and all these things. So for example, in the last webinar we did, I asked this very question to Dr. Garrett Boyer, who is a recent graduate from our program, and he said,
Mhm.
I thought this was interesting, that some people, and this almost sounds so like hackneyed almost, right? Because it's a very common thing. It's like that you hear that people they go into psychology because they have issues themselves and they want to try to resolve them within
Mm.
an academic program, doctoral program, master's program, whatever. And he
Yeah.
mentioned like that's not a super that's not a great reason, because it's like while it is true that and feel free to comment to this,
Mhm.
it's like that, that people do certainly grow and develop while they're here intellectually, interpersonally, clinically. They probably gain a whole lot of self-knowledge, and so they're able to kind of like sort of gaze into their own soul in a way, in a different perspective than they were able to before. But really, the purpose of getting into doctoral level or even master's level work in clinical psychology has to transcend itself. One has to deeply desire to be of service to other people in this field. Would
Mhm.
you agree with that?
Yeah, I certainly would. I think personal growth and insight into yourself is a byproduct of of the work. I think it's inevitable. Um, one of the key um, one of the key tools or skills that you learn in the program is empathy and
Mm,
the ability to empathize with another person in order to help them dive into their experience and to help bring about transformation. And in that process, you have to change. Um, at some level as you grow and develop that skill and you develop insight into yourself. But I think having that as your goal is I would agree with what you mentioned. I think that's misguided, and it could be problematic.
sure. But I mean, on the
Because your
other,
motive is to be, or your purpose should be for your client, right? To be we say or the dean here says to be with and for your client,
yeah. But then I
not
mean, like,
not for yourself.
totally. I mean, but on the other hand, though, this isn't to say that one need be like have all of your stuff together, be anyway perfect or something like that to enter into a PsyD program or anything like that. It's like we all have we're all fallen people, but so you don't have to have like your act totally together as it were to enter either. Okay.
No, definitely not. One of the books that we read in the first year, and I can't remember the author, but the book's called The Wounded Healer.
Yeah.
And it's to and in the first year, really, before we start our clinical work, we're supposed to start thinking about how to work with another person, and understanding and recognizing your own brokenness. And as you say, we're not supposed to have things all together. That's not, if we had to do that before we were able to be psychologists, it'd be a lot longer than 5 years
Yeah.
of training.
It'd be an indefinite like admissions process.
Yeah, exactly.
Good. Okay. So to your mind, what would be some key differences, or how might you distinguish between someone that is meant to be a counselor and one that wants to be a clinical psychologist? But in terms of interests, in terms of work that you might do in either of these professions, because a lot of times me doing PsyD admissions, this is a very common question, and it's because we at Divine Mercy both offer a PsyD, a doctoral level degree in psychology, clinical psychology, but also a master's level degree in counseling. And I think it's fair to say that there's a great deal of overlap between these two fields. But how might you tease out the distinction between these two fields for those of our listeners who are sort of on the fence, as it were?
Sure. So I think the first thing that you have to decide is, or that you have to kind of understand, is that different jurisdictions have limitations on what you're able to do with particular credentials. And that could be the country that you're from, or the licensing board, particularly that I'm Canadian. and I'm looking to go back to my home province to practice once I'm finished. And so I contacted them first year and made sure I knew what their licensing requirements were coming from a US program. And so different jurisdictions will have greater limitations on what a counselor can do, your kind of scope of practice, versus what a clinician, what a clinical psychologist can do. And often that might include psychological assessments, and report writing is a huge part of often a clinical psychologist's purview. That would not be part of a counselor. A clinical psychologist often typically will be seeing more severe case presentations, especially if you're interested in work with in a psychiatric hospital. I'm hoping to get a placement like that before I'm finished my training. Whereas if you're interested in adolescent counseling, maybe you want to look into what it's like to be a counselor at a school, something like that. So I think you have to kind of determine where your areas of interest are, and then see what you need to do that in the area that you'd like to practice in. I think those would be my practical recommendations. And a good place to look early on, so you don't end up somewhere that you don't want to be a couple years down the road, and you realize that you actually needed something different.
Yeah, agreed. I mean, I think one thing that people often ask is like, well, is it just necessarily better that it's a doctoral level degree? And so therefore, if I can get in, should I just do the doctorate regardless? And it sounds like, that's not a good strategy, simply because, for a couple of the things that you mentioned in terms of the field differences and the scope of practice between psychology and counseling, but also for the kind of maybe even more practical reason, that is the doctorate is intense. It's 5 years. It's full time. It's in person, right? It's more expensive than counseling. And so it's really not prudent, to kind of put yourself through this very rigorous training if really, you're really better suited for counseling. And it's really just a matter of honoring your individual, like you said, your individual, like what you're actually interested in, rather than simply doing the doctorate for its own sake. However, like if you do it for the right reasons, if those things that you really want to do are only possible with the doctorates, like the testing that you mentioned, that's so quintessentially clinical psychology, then it's well worth it to take the 5 years and to get the doctorate and to get the adequate and requisite training and the hours and the expertise that would demand. So good.
Yeah, definitely good. Like don't write one off because it's seems like less credentials or something like that, or don't write up PhD or a PsyD because it seems like too much work, if it's really what you want to do.
Yeah, exactly. I mean, for some people that's their goal. Okay. What would you, Malcolm, you've been here for about 2 years now, but what would you say would be maybe 1 or 2, 3 at the most formative ideas that have been most impactful for you as a scholar and as a clinician, a budding clinician?
Sure. The one that comes to mind first is the literature on the common core elements of psychotherapies. There's a problem of replication in psychological literature. It's really hard to get to replicate studies and to find consistent findings in different areas, just because psychology can be so much variance between individuals and things like that. But one of those replicated findings that is found over and over again is that different modalities share common core features that are the main vehicle of change for clients, and those are typically empathy that is shown towards a client by the therapist, and the therapeutic alliance. So one of the things that's found over and over again is, regardless of whether you're doing a cognitive, behavioral, interventions or psychodynamic kind of exploration of traumatic history, something like that. It's the alliance between the therapist and the client, and the experience of that relationship that is one of the primary vehicles of change. So maybe on a clinical level, that's probably what sticks out to me the most, and what I was most impacted by in my first year learning it, and then my second year experiencing it in the therapy room. And on an academic level, I think I've been impacted by the integration of philosophy into the psychological realm here. And one of the main areas that I've seen that is the implication that virtues have on the individual and developing virtue, and how, as part of our anthropology or DMU, is we believe the person is developmental, which is very consistent with the psychological literature, but also our concept of virtues, that they're developed within the person through practice and through exercise, and through action that doesn't necessarily require your felt experience to be positive, that sort of thing. So maybe from an academic side, what I've seen really helpful is putting things in the context of virtue development, and that really helps me to understand the process of change within my clients. I don't know if those apply to kind of your question.
Yeah, that's exactly what I'm asking. I mean, yeah, in fact, it's funny you mentioned this, because I was just talking with Dr. Payne, who's the dean of our counseling program here, and he said just that about the role of having a therapist that's empathic, and one that builds that, how did you put it, the therapeutic alliance,
Therapeutic alliance, yeah,
being a strong one is far more impactful than the particular modality of therapy that the clinician uses, whether that's, like you said, like CBT or psychodynamic or humanistic or existential, what have you. Yeah, and then the role of virtues, I think, is makes a lot of sense. I mean, that sounds like that would be a really, you might even say, a distinctive feature of our own program, because it's I remember Dr. Vitz in one of his latest Newman lectures brought the role of, or rather the reemergence of virtue within psychology through the work of Martin Seligman, and the strengths-based psychotherapy, people that are really retrieving the virtues that the Greeks talked about, and then medieval philosophers and theologians talked about, and now modern psychology is seeing all these things as helpful as part of the therapeutic process. And I think that, given our nature and mission, I mean, that's certainly something that I think a lot of our therapists see as helpful. So,
absolutely,
good. All right. So you mentioned, integration a number of times. So I just want to press this just a little bit further here before moving on, because a lot of people, when they hear about integration, that's a very nice word. That sounds great. Like you said, the through tradition is philosophy, theology, and psychology. But a lot of people want to know, like, okay, how does that work? I mean, it makes sense. Okay, so you've got our integrative studies classes, philosophy of the human person, theological anthropology, the theology of marriage, seeing the human person through the lens of the church and the way that the church speaks about the human person. That's wonderful. But then we also talk about how, as you mentioned, that the integrative project is also part of our psychology classes, and that this is one of the distinguishing features of our graduates, is that they have this background. They're able to, as you said, apply it in a clinical setting. Would you be able to say a few things about how exactly that functions
within kind of an applied setting?
Yes.
Yeah. So one of the things that is kind of hammered into us over and over again is approaching our case conceptualizations from an integrative perspective, which means not neglecting aspects of the human person or aspects that are important to that individual. for example, there's quite a bit of literature coming out about the importance of spirituality to clients, and how the majority of clients will report that spirituality is important to them, whereas a minority of therapists will report that it's important to them, or that they're competent to deal with those kind of issues. So obviously this is a very specific example and related to theology more. But coming from an integrative perspective, we wouldn't want to overlook the aspects of a client's spirituality that are important to them. And we would want to understand how those are affecting their presentation, whether it's, someone who's really struggling with OCD, and what they're really struggling with is a scrupulosity about the morality of what they're doing. That's very related to their religious, spiritual beliefs. It's not simply, it's not simply a random thought or intrusive kind of cognition that you might not understand the source of that. Looking from a purely CBT perspective, if you weren't trying to consider where is this coming from, considering their experience, considering their cultural background, considering their beliefs and what's important to them. So that's just maybe one example of a way it might be applied. It's really about trying not to neglect any part of the person. And anyone who's seen the Catholic Christian meta model of the person, the book written by Doctors Witz, Nordling, and Titus, it's quite a thick book, and there's a lot, and so that gives you an idea of the integration process is not an easy one. There's a lot of aspects to the person that we're trying to consider when we're applying it to our clinical work here at DMU.
Yeah, I mean, correct me if you think this is wrong, but it seems like, our approach being, what we mean by integration is that we really think of the whole human person. And it seems also to be the case that a lot of that seems to be very much in vogue when people, invoke holism in psychotherapy. That seems to be very popular, but we have because we adhere to, or we believe in, a Catholic anthropology of the human person, we actually have a philosophical reason for understanding how that's more expansive than something that's more reductive and materialist, right? Because it's like, if the human person is simply, an advanced piece of matter, then it would make sense that, a lot of, like you said, like a lot of therapists wouldn't see exactly why things like spirituality would play a role in people's flourishing. But if you can acknowledge that, man is more expansive than simply his material functionality, you would be probably better prepared to honor and support this people's spiritual elements. Is that fair?
Yeah, I think that's really important what you brought in about the foundation that we have for these principles, and at times these are things that more secular psychology would accept. There's a famous psychologist. I won't throw shade on him by mentioning his name, but there's a well-respected secular psychologist who's an atheist and says we just have to accept that the person is good. In order for therapy to work, we have to accept that. Now, he doesn't have a philosophical foundation for why that's the case, or any kind of grounding to support that claim, but he understands that in practice, that's what he's seen to be effective. In his years of experience, that's effective. And now what we have is an understanding of why the human person is good, and that gives us a game plan with what sorts of things are going to provide the person with fulfillment in life, and why are those things providing fulfillment in life.
And like it just seems like without at least that conception of like seeing the human person as good, and like you said, that we have a reason for thinking that, namely that we're made in God's image and likeness, right? But without sensing that there is human goodness, that even though we're fallen and the rest of it, that shows that there's a basis for hope, right? I mean,
exactly.
that if man is simply privation, what good could psychotherapy possibly do? But that's, like, as you say, that's simply not the case. That can be observed both from like the experience of successful psychotherapy, but also from our philosophical conception of man.
Absolutely.
Okay, good. I just want to see, it looks like we have a few questions. Maybe we can field them now. All right. Stephen Jensen, has your philosophy / outlook on life changed at all since learning to be a psychologist? Malcolm, I'll let you take that one.
Yeah. So I think it has, and particularly in my conceptualization of truth, and don't get scared by that. I think in my undergrad, I coming from a Catholic high school experience, and then studying Catholic philosophy and morality for a couple of years after high school. I was very steeped in in the Thomist tradition, in the Western philosophical tradition. I was very much an advocate for objectivity and objective truth. Let's not give into relativism, those sorts of things. And I encountered actually my psych professor in my undergrad, who challenged me on that, and he's someone who is very opposed to, who maybe on the other end of the spectrum from where I was at, but he challenged me. What do you do when someone has their experience that they bring you? And he's coming from the perspective of a practicing psychologist. He says someone brings their experience to you. What do you do? Do you just tell them that's not true? And so that was something that kind of stuck with me. And I think I didn't totally understand it until I actually started seeing clients myself here. And it's not to say that I have at all, given up my fealty to objective truth. That's certainly an important part of the Catholic anthropology, that there is a truth that we strive to, and that guides everything we do. But I think it has shaped in me a respect for subjective experience, and understanding that how a person has experienced things, different factors in their life, and understand that we all perceive things slightly differently. It's like the parable of the blind men and the elephant. Like, there is an elephant there. One of them's touching his trunk, and he says it's very much like a snake, and another one's touching its foot, and he says an elephant's very much like a tree. They're all touching an elephant, but their subjective experience is important. And when you're in the therapy setting, that's what you're coming up against, is someone's subjective experience. And so I think this is something I'm hoping to write on in the future, when I have time to write things I want to. But I think that's maybe the most conceptually the biggest change in my thinking, is a respect for the importance of subjective experience, without sacrificing objective truth.
Yeah, I like that, because it's like, it doesn't, appreciating one doesn't mean that you reject the other, right? Because it's like,
No.
As a clinician, surely, you have to be able to honor people's individual experiences. But on the other hand, it's not as if human nature itself is somehow radically different from client to client to client to client, right? So, like, they all have, a material dimension, a spiritual dimension. They all have emotions. They have a heart and a mind and a will, right? So it's not like a nominalist kind of repudiation of, like, that there is like a human nature, but rather, like you said so well, it's like that each person, despite having a universal human nature that is instantiated in different people, the actual experience of our particular humanity is different, and that's why you have to be attentive to that as a therapist. Okay, the same person looks like he also asked. Okay, Stephen Jensen, not being Catholic myself, how much Catholic history tradition is useful to know before starting the program?
That's a great question. I'm probably not the best person to answer that, given that I am, and I had quite an extensive history of Catholic teaching before the program. But I do have one of my classmates is coming from a Protestant tradition, and it often is valuable for conversation. I find to have those other perspectives in the class, and particularly when we're in our philosophy classes that are very Catholic Christian anthropology focused. So there's certainly a Catholic bias, but it's very Christian in its fundamental understanding of the person. And so I think, as far as what to know before entering, if you're coming from another Christian tradition, I wouldn't worry about it too much. I think there's a lot of you're going to get a lot of foundational instruction on the basics, as well as the more complex issues. And there, in my experience, there's always lots of time for discussion in class. At university, our class sizes are much smaller. They're often have a more of a seminar feel, and there's lots of back and forth between professors and students, and between students. So I think there's a lot of opportunity for mutual learning from each other, and there's going to be lots of opportunity to get kind of those foundational principles and to wrestle with them in your first year, really, as you're taking the philosophy aspects of the program in. So yeah, I wouldn't worry too much about it.
Well, okay, good, excellent. So with that, let's transition into the PowerPoint. If you give me a second, I will upload it, and then we can dive into more of the particulars of this program. So again, if people joining us, if you have questions, please lodge them in the chat. So let's get into it, the overview of the PsyD at Divine Mercy. So Divine Mercy is a Catholic graduate school of psychology. It was founded in 1999 as the Institute of the Psychological Sciences, and it was dedicated to, has been dedicated to the scientific study of psychology with a Catholic Christian understanding of the person, marriage, and family. And its expansion from IPS to DMU occurred in 2016 to facilitate growth and add a counseling program at the graduate level. So we're one university under the umbrella of DMU, but we have two distinct schools. We have the School of Counseling, which offers a master's program, which is mostly online, though is also hybrid in the sense that there are episodic, requirements to come to campus for different clinical things. And then the Institute of the Psychological Sciences houses both our residential doctorate, which is what we're talking about today, and also a master's in psychology, which is exclusively online. So our mission is to provide students with an effective academic and educational environment that supports the integration of the psychological sciences and a Catholic Christian understanding of the person through teaching and learning both knowledge and critical skills. Also to assist students intellectually and professionally as they prepare themselves to respond to the vocation as mental health professionals. So Divine Mercy, the campus of DMU, is located just outside of Washington, D.C., our nation's capital. So it's about an hour, I would say, west of the heart of the city. So we are in the suburbs. But for those of you who have ever been to this area, it's truly I would say it's just a great place to work and live and study, regardless of whether you're an outdoorsy kind of person and you like to be outside and you like to go hiking, because we certainly have that. To the west, we have the Appalachian Trail, which goes from Maine to Georgia, and it kind of runs through the western part of Northern Virginia and West Virginia. So if that's your bag, we have all that there. If you're more of a city person and you enjoy artistic and cultural opportunities in the city, that's also certainly on offer to the east and DC. So Divine Mercy is institutionally accredited by SACS, the Southern Association of Colleges and Schools, and SACS is recognized as an accreditation agency by the U.S. Department of Education, and DMU has voluntarily participated in the accreditation process and met or exceeded all standards in thorough evaluation. We're also approved to operate by SCHEV, the State Council of Higher Education in Virginia, and the PsyD program has been recognized since 2006 as a National Registered Designation Program by the Association of State and Provisional Psychology Boards. And perhaps most notably of all is that we are accredited by the APA, the American Psychological Association, since 2016. And we've also been approved to participate in the National Council for State Authorization Reciprocity Agreements. So as a therapist or practitioner, you would be able to perform psychological assessments and testing for diagnosing purposes, journeying with your clients toward healing and flourishing. And like Malcolm had mentioned, not too long ago, it's that the hallmark of clinical psychology is precisely the ability to carry out these tests. And you would receive ample and thorough training in psychological testing assessment here at Divine Mercy. All right, this slide offers an overall broad brush strokes picture of the program itself. So it's totally 122 hours. That does include a master's in passing. So Malcolm has just received a master's in psychology. Congratulations, Malcolm. So that would be received after the second year of study. And then an additional 3 years for the PsyD. And the first year, the first 2 years of the program is really kind of your full-time exposure to the major science classes in psychology. In addition to that, you will also take a class a semester in integrative studies, as Malcolm mentioned, the philosophy and theology component of the curriculum. But also, again, the second year, this is your first foray into being a clinician. So you're going to see maybe 2 or 3 clients in addition to your full-time load of courses. In years 3 and 4, it does transition somewhat. So you'll have less time being spent in the classroom and more time being spent at clinic. So it ends up being kind of like a split between the two. In the 5th year is the internship. So this is somewhat analogous to a medical school residency in the sense that you apply to the internship in your 4th year. And typically these internships, you want to apply to those that are in your academic or clinical wheelhouse. Things that really interest you are great sites that you can apply depending on whether that's your interests lie in, say, autism or addiction or psychosis or bipolar, whatever those things are, or if there's some psychotherapy school that interests you. These sites are diversified, and so you would want to kind of get invested in those that are most interesting to you. However, I should say that these internship sites are scattered throughout the country, so you can basically go wherever in the country, but if you wanted to stay here locally, you could certainly do so. For example, we have these local sites here, St. Elizabeth's in Washington, D.C., Psychiatric Hospital, Washington, the Virginia Medical Center are all in the area. So if you wanted to stick around in the area for the 5th year, you wouldn't have to leave, provided, of course, that you got into these internships. Also, I would be remiss if I didn't mention that we had 100% placement into APA accredited internships this year. So, and then the year before, we also had 100% placement. And I think in the year before that, it was like 98. So in other words, all that to say is that your chances of getting into a solid APA program internship is extremely high. So that's with that. Malcolm, have I missed anything? Is there something you might want to add to this overall structure?
I don't think so. That's pretty comprehensive. I think I didn't totally understand when I was starting the whole structure of application to external sites and how that would look. But it's definitely scaffolded for you along the way to kind of get comfortable with that system.
Good. Okay. Excellent. These are some questions of discernment that you might ask yourself regarding the PsyD. So would you want to help people flourish? Are you interested in the science behind human behavior? Do you want to become an instrument of healing through the psychological sciences? Are you interested in performing psychological tests and assessments to diagnose your clients and create treatment plans? Are you looking to start a career as a licensed mental health professional and specifically as a clinical psychologist? Do you have the ability and desire to work with all types of clients from acute care to more challenging and long-term client cases? And like Malcolm had mentioned, being getting the doctorate and receiving the highest level of clinical and academic expertise, it's very likely, certainly possible for you to deal with these difficult and sometimes severe cases of mental illness. These are the major areas of competency that do aim to inculcate in all of our graduates by the time they leave. So foundations in psychological science and research, integrity and practice, assessment and diagnosis, therapeutic intervention, professional roles, and then clinical practice from a Catholic and integrative perspective. I'll go through each of these in turn. First is foundations in psychological science and research. Graduates will attain foundational psychological science knowledge of biological, cognitive, affective, social, and developmental aspects of the human person, as well as history and systems of psychology, psychological measurements, research design, and statistical method. Graduates will have the skills necessary to conduct their own psychological research. 2 is integrity in practice. Graduates be knowledgeable in areas of diversity and ethics, and display critical thinking, self-aware, and effective practice, and self-care. Graduates will demonstrate responsiveness to supervision, collegiality, and professional comportment in professional practice. 3, assessment and diagnosis. Graduates be able to conduct clinical interviewing, perform intake evaluation, demonstrate knowledge in the administration, scoring, and interpretation of psychological assessments, integrate multiple sources of test data and clinical interview information into a written report, diagnose and develop a treatment plan. 4, therapeutic intervention. Graduates will be able to demonstrate case conceptualization, treatment planning, building and maintaining a therapeutic relationship, psychotherapy skills, crisis management of urgent and special circumstances, and discharge planning. 5, professional roles. Graduates be able to function in a variety of required roles. A professional psychologist to include consultant, educator, supervisor, practice manager, and program evaluator. They'll be able to work collaboratively within disparate teams and with clients. And then 6, clinical practice from a Catholic integrative perspective. Graduates will develop a Catholic understanding of human flourishing in individual person and marriage and family life, and be able to integrate this with psychological sciences in clinical practice. So as I'm sure many of you are aware, the field of psychology is a highly diversified one in the sense that there's so many different areas in which you could become expert within or practice within. But the main task of the program is to get you licensed as a clinical psychologist. In fact, we have a 97% rate of our graduates go on to get their LCP, licensed clinical psychologists. But moreover, it's very likely, should you want to take advantage of it, that you would be able to assume positions of leadership within the psychological community and the mental health community, things like being a clinic director, or like Malcolm had mentioned, the desire to get a hospital placement, work in a psychiatric hospital is also certainly not beyond the realm of possibility. All right, we've had legions of students come to our school, many of whom have just come here and flourished. These are just a few of many testimonials. James Walovich has said, in our clinical psychology program, the training is focused on healing the whole person. Kristen Long, I was drawn to the PsyD program out of a desire to serve others in a more profound way than my previous positions offered. Timothy White, the school is not afraid to teach you what it means to be human at every level, psychologically, philosophically, theologically. That's why I like it. And then Kirsten Curtis, I'm so thankful for DMU. The faculty members are very supportive, and I received lots of hands-on and clinical experience. This is a video testimonial of one of our third-year doctoral students here at DMU in clinical psychology. William Johnson has done work with PTSD and combat veterans himself, having come from a military family.
Hi, my name is William Johnston, and I'm a PsyD student at Divine Mercy University, currently approaching the end of my third year in the program. Military service runs in my family, and so both my grandparents served, my parents both served. This door, the PsyD program at Divine Mercy University, opened that opportunity for me to continue to give back, to conduct research, and hopefully implement a more robust program to treat PTSD as it relates to combat veterans. DMU has certainly provided the integration that I've sought in terms of my formation, both the philosophy and theology core, in addition to the psychology curriculum, has provided me growth in terms of my faith and my role as a husband and father, and of course a psychological clinician. So in essence, the Catholic Christian meta model of the human person is why I'm here, both for my own sake as well as the sake of my future clients.
This is another video testimonial. This is from a recently graduated alumna from the PsyD program.
I would say that being a student at Divine Mercy University, or DMU, is one of the best things that happens to me. I really appreciate a great support from faculty members and also classmates. I have gained a great deal of knowledge in all aspects of clinical practice, research, and also professional development. DMU not only provides students with strong academic skills, but also prepares them for a career in psychology. I personally benefit from mentorship with academic advisor and clinical supervisors. As a person, what I most appreciate from DMU is that its mission helped broaden my perspectives in understanding a human person through the lens of Catholicism. Catholic principles, especially in hope, love, and faith, are very valuable and certainly helped me become a better clinician.
We offer a generalist program in psychology here at Divine Mercy University. So we have faculty with expertise in virtually every area within psychology, both academically and clinically, everything from child and developmental psychology, personality, social psychology. We also have, you'll be exposed to all the major fields within modern psychotherapy, everything from CBT, psychodynamic, humanistic, existential, strengths-based psychotherapy. These are just a few of many of our professors. Dr. Lisa Kloicki is our program director, but she's also the dean of IPS. She's also a specialist in adolescents, adults, and couples therapy. Dr. Diane Graves is the assistant program director. She's a specialist in child and developmental psychology. Dr. Pecoraro is an expert in addiction and trauma. These three gentlemen here at the bottom were amongst the founding faculty members of our school back in 1999. Dr. Scrofani is an expert in CBT and group therapy. Dr. Nordling, his expertise is in child, marriage, and family. In fact, he was recently rated as the #3 expert in play therapy in the nation. Dr. Vitz is a massively important and pivotal founding faculty member in the sense that he, in fact, once in his previous life was an atheist. He was a professor of psychology at New York University. And he and his wife underwent a rather profound conversion from atheism to Catholicism. At any rate, Dr. Vitz eventually left New York, left the New York University and then founded Divine Mercy. In fact, later on in his life, when I think he was in his 60s. So anyway, to say the least, is Paul Vitz is recently retired from us formally. But his work is enduring and seminal. His writings on his first one, maybe arguably the most important, called Psychology as Religion. It discusses what you might say is his critique of 20th century psychology, Rollo May, Abraham Maslow, Erik Erikson, Rogers, and the rest of these people, and what happens when psychology becomes divorced from any sense of teleology or theology, for that matter. Anyway, Dr. Vitz's work is really good. Highly recommend it to anyone who's interested in psychology in general, but Divine Mercy more specifically, especially the PsyD program. Malcolm, do you have anything to add to the faculty? What I mentioned about the faculty, something that's salient that maybe people would help our listeners?
I think what really has stood out to me is the investment that they all put into us as students, and you definitely feel the support, and once you're here, everyone wants you to succeed and is helping you as much as they can. So that's definitely what I've experienced from the faculty here.
Yeah, all right. So I mean, that we are a smaller school has certain advantages, right? I mean, there are certainly advantages to going to a big school. There's lots of money and resources, but really, it's what Malcolm just said about the faculty being extremely supportive. It's a mutually supportive environment between students. It's not like going to a cutthroat law school or anything like that. It's everyone wants each other to succeed, and certainly the faculty as well. And you're going to get lots of individual attention just by virtue of it being smaller. People are going to know you certainly by name and on all of your interests, academic and personal, and things of that nature. Good. Okay, licensing. Malcolm did mention a bit about this in terms of, being Canadian and the logistics of that coming from an American school, returning to Canada. But for this is some very general knowledge about licensing. Certainly a license is required to practice in each state where you would practice as a psychologist. When a licensing process begins after the student begins the practicum and internship and officially completes the practicum and internship and officially graduates from DMU, states can and often do have additional and different requirements, and students are responsible for checking state requirements where they plan to work and adhere to them. These typically include national essay exams. Like Malcolm said, he did research into this in his first year, and that's certainly advisable, so then to know where you want to end up and what their requirements are. But also, DMU will provide general information related to licensure during your own experience. Now, who initiates that licensing? It is a student-driven process, so it's important for students to begin research of licensing requirements in the state they plan to work in as early in the program as possible. Will students be fully licensed after graduation? No, typically graduates must work for about a year in a supervised clinical setting, in addition to other state requirements to be licensed, and the graduate may be required to obtain a provisional license for that year period. So be sure to check your state for individual requirements. Am I missing anything there, Malcolm?
No, just to emphasize again, each area is different. Some places you need a postdoc, some places you don't. Pretty much everywhere you're going to need a, ethical and competency exams. So, but look where you're in the, if you have a few different areas you might want to practice, just take a look around and get an idea of what you're going to need.
Right. I mean, speaking of postdocs, for those of you who are interested in an academic career, if that's more of your bag, let's just say that, because while it's true, like Malcolm mentioned, that the PsyD is often has a more of a clinical focus rather than a research one. If you come here and maybe it's race, you discover that, I really what I want to do is I want to be a professor of psychology. I want to carry out research. I want to publish books and articles and teach at a university and things of this nature. Those doors are not closed off to you by any means. In fact, we have a number of our faculty who have PsyDs themselves, who do all of those academic activities. However, like Malcolm said, some fields in psychology are going, and especially if you want to be in academia, are going to require a postdoc. For example, one of our faculty, Dr. Rebecca Morse, the director of research training here, would be a fantastic resource, once you get here, because she's really expert in helping our students get into academia if that's what they decide to do. I think a good example of this might be, anything in neuropsychology where there's such a deep knowledge base and it's such a sophisticated and scientific area within psychology that's going to require more training. Okay. These two graphs depict a distinction I like to draw between buying something that's utterly material, like a car. It's like you get a car off the lot, and eventually before too long, the car depreciates in value, and all of a sudden it's worth like half as much as it was when you bought it. Contrast this for a moment with an investment in yourself, in your own knowledge, and especially in a field as in demand as psychology. Our modern world is pervaded by so much isolation, loneliness, depression, anxiety are fairly common. And so there's a great need for clinicians at both at the master's level and at the doctoral level. And so your skills will be very much in demand. And so as you become ensconced within psychology and whatever practice that might look like, the value of your degree is going to ascend. It's going to appreciate because you're going to be better known. You're going to be more expert. People will want and need your services. The investment itself, so it is $1,170 per credit for 122 credits over the course of 5 years. This is $142,740. That doesn't include fees or indirect expenses such as housing or gas or food or any of that. Typically, students do apply for federal aid to fund their education through loans and grants from the government. Provided that you feel comfortable applying, once you do so, our financial aid office will rapidly and swiftly get in touch with you to help work through the financial piece of this. We also offer a number of ways of defraying the sticker costs, which frankly, almost nobody ends up paying, through a number of ways. First, we offer on-campus work study programs. Basically, students work either with me and my colleagues here in admissions or in the business office. These jobs are fairly straightforward ones, and they're on a part-time basis, usually between 10 and 15 hours a week. They're not superly demanding in terms of the cognitive abilities, so it's a nice respite from an otherwise rather demanding doctoral schedule. For our Catholic students, we also offer diocesan investments, which is a memorandum of understanding with a diocese. So suppose that you were a Catholic student and you were admitted to our program, you could reach out to a diocese and say, hey, let's just say this was Malcolm some time ago. I'm Malcolm and I'm starting the doctoral program. Typically, dioceses will offer Catholic students up to 15% off of tuition. So that's certainly something to take advantage of. We also offer a whole slew, as you can see, of admission scholarships to which you could apply to 4 of them and receive 2 of them. And they pay out up to the amount indicated on an annual basis. Moreover, we have academic or merit scholarships. These are for really, you might say, our top candidates. This is determined not by application specifically. So for example, all of these scholarships you'll need to, in order to receive them, you'll need to apply to them. And so in some cases, it will require an essay, a brief essay typically. But the merit scholarships are doled out according to the faculty's evaluation of each candidate. And these include a number of elements that are part and parcel of the application, your essays, your recommendations, your grades, your GRE score, and also how well you did in the interview itself. All of these are factors that are considered, and then the faculty will rank the applicants according to merit order, and the top 5, 6-ish applicants will receive merit scholarships ranging between 50, half off of tuition, and 25% off of tuition. So, and typically I would say to be competitive for these merit scholarships, you probably need a GPA of at least 3.5, honestly. All right, entrance requirements. We do require at least a baccalaureate degree from a regionally accredited school. But we do prefer that you have studied psychology. If you haven't done so, that's not a problem. Frankly, we've had scores of students come through our doors and go off to be amazing psychologists without having studied psychology at the undergraduate level. So if that's you, fear not, it's totally fine. We've had people from the hard sciences come in and do well. We've had people with humanities degrees, and it's quite all right. Now, that said, if you have no psychology background whatsoever, we will probably require you take a prerequisite class of the course of your first year, which is an online course, which is really a undergraduate level class that's spread out over 2 semesters in the first year. So for the most part, it doesn't really add that much to your schedule, and most people do just fine with it. I would also note that in terms of GPA requirement, you're going to need at least a 3.0 on a 4.0 scale. If you are not quite there, let's say that your GPA was like in the high 2, let's say you had a 2.8, 2.9 or something along those lines. Don't despair, come to me, talk to me, email me, schedule a time and we can talk about it, because sometimes people have very good reasons why things didn't do so well in undergraduate days, and we might be able to make an exception. So if that's you, know that. Now, in terms of applications, suppose all of this has made sense to you, and you really want to move forward in the process, the thing to do is apply online. If you go to our website, divinemercy.edu, and you go to the PsyD in clinical psychology, you'll see the application button on the far right side. Click that and it will expand, and then you can go ahead and apply. Once you apply online, our financial aid, like I had mentioned before, our financial aid office will get in touch with you, and thereafter we maintain communication. But then once all the other elements of the application are received, and your application is complete, I'll have the dean review your file, and then hopefully you'll get an invitation to interview. Now, we have 3 different interviews per academic cycle. So in this coming year, the first one is November 10th. This is our earliest interview. It's very popular for a couple of reasons. And the first is that we offer $3,000 off of your first year's tuition, sort of no questions asked, provided that you get your application in before October 25th. That's the deadline to receive that money. The other thing I would say is that more often than not, we tend to dole out the most merit scholarships in the November interview. So if you think you're competitive for that, you might stand a better chance of getting it earlier on. But also, we're here in June, and so it's very much the timing wise, it would make sense that you would get into this interview in November. Now, like I say, the online app is the first part of it, and there is a $55 fee that accompanies that. Once that's finished, you get into part 2, and these things can come after you've submitted the online application. So the first is that you will be asked to compose 2 essays. The first will ask about, why you want to be a clinical psychologist, why do you want to study at Divine Mercy University, and then secondly, what are some of your academic and clinical interests? So, Malcolm and I have discussed some of his own in parenting and adolescence and technology. If whatever yours are, you want to bring that to the fore in these essays and talk about them and how you would use them, say either in the dissertation or perhaps after graduation as a clinician. Also, we will need your your professional resume sent to us. It should be up to date. We do also need 3 recommendations, 2 of which can be, 2 of them must be academic in nature, so they have to come from professors. Let's say you've been out of school for some time, and your professors are completely, say they retired, or they're, God forbid, they're dead, or whatever they may be. If that's not possible, if you can procure 3 professional ones, so from supervisors past and present, those would suffice. But we do prefer to have at least 2 of them be academic. We also need your transcripts from your undergraduate and graduates. If you've gone to graduate school, you don't have to have gone to graduate school. But whatever transcripts you have need to be sent to us. And then finally, the GRE. So we do require the GRE. It is not the most important part of the admissions process. So we are going to pretty much, I would say, every other part of the application is probably more important than the GRE. But the faculty do look at your scores. Now that said, it's not like it's extremely unlikely for you to get rejected simply on the grounds of having a low GRE score. However, if you're gunning for a top merit scholarship, getting a good GRE score is extremely helpful. Oh, and I would also say that, once you take the test and to have your application completed and reviewed, and to get an invitation to interview, we do need to have received them. So a lot of this does come down to timing. And so on average, it's almost always better to get your GRE done than to have it done perfectly, and to get it done in a timely manner, because it's going to take a week or 2 for those scores to get to us. So it's in your best interest to go in, take the test, do the best you can, and then have them sent to us through the school code. 5639. If you happen to be an international student, please be aware of this. So students that have degrees from outside the United States need to have their transcripts reviewed for a course by course evaluation through west.org. And also, we need to make sure that it's at least the equivalent of American baccalaureate degree. And it also needs to be translated if it's not in English. And of course, this cost is your own. If your primary language also is not English, so let's say that you don't use English on a regular daily basis as personally or professionally, you will need to take the TOEFL or the IELTS academic test for a program. But if English is your common tongue, your native tongue, and even you use it on a daily basis, then no need for that. Okay, good. That's all I have in terms of information. Let's take a look at the Q&A. Okay, someone is asking about the importance of the jury. Yeah, I just mentioned that, but one last thing I will say is that there's no cutoff score. So a lot of schools might regard the GRE to be a weed out tool to sort applicants, but there's no such thing here. We don't have a minimum score such that if you don't attain it, you're out. It's not the way it works here. So yeah, I would say do your best. It is a component, but by no means is it the most important component. It's better to get it done and done timely than to get it done perfectly. All right, let's take a look at what else.
I could add something to that maybe.
Oh, yes, please.
With regard to the GRE, I'm not naturally a STEM person. I went out of high school thankful to not have to look at biology for a while and went and studied philosophy. But I would, take it seriously, but don't be intimidated by it. Study for it and do your best, like Bradley said. And also maybe if I could offer some, in retrospect, approach it as a good exercise, especially if you're not confident in some of those areas, or maybe you've been in studying humanities and haven't looked at algebra for a while. Take it as an opportunity to brush up and to kind of flex those muscles again.
Yeah, thank you, Malcolm. All right, let's see what else. Would a letter of recommendation from a seminary teacher count as an academic recommendation? Yes, I assume what you're asking, is if this is a seminary professor, then absolutely. Yeah, because as long as they're not like high school teachers, if they're professors in a seminary, that would absolutely be totally fine. Let's see what else am I missing here. Okay, another person is asking about time frame with the GRE. They took it, Shayla, looks like you took it 5.5 years ago. That's a great question. Because the timing of this is important. If it's been over 5 years, I'm afraid you're going to have to take it again. We would consider anything more than 5 years to be dated, and you would just have to reschedule it and take the test again. If you're thinking of getting into the November interview, I would, if you want to kind of be competitive and get all of the elements of your application in to really kind of secure a spot, I would probably have the GRE done by the end of the summer, honestly. August, because it's going to take, again, it's going to take a couple of weeks for us to get the scores. And it's just kind of the GRE, in my experience with the GRE, it can really kind of slow people down, and even in some cases prevent them from completing their application and not getting in to an interview, and then not getting to fulfill their dreams in life. So like, please don't let the GRE get in the way of you getting what you want in life, right? I mean, if you really want to be a clinical psychologist if you are sold on our meta model and what we are able to offer you in all the ways that we've talked about with me and with Malcolm and I today. Just get the GRE done, okay? Don't feel like you need to study for months and months and months or any of that. That to say, if you want to study, I'm not trying to discourage that. Like, you know, Malcolm said, it can be a good opportunity to bone up on math and things like that, and that's wonderful. But please keep the perspective of this in mind, okay? Because most of our applicants aren't like you know, Malcolm had said, it's like he's not really like a STEM person. And honestly, a lot of our applicants aren't, because this is a program in clinical psychology. So if test taking and GRE taking and SAT taking are not your can of worms, like, it's okay, you're in good company. Just register for the test and do the best you can. Okay, I think that okay, it looks like another person, you know, you're leaving in the webinar. Yes, this webinar will be recorded and it will be posted on YouTube, so no problem. It will probably be posted in a couple of weeks, and then it will be there to watch as often as you would like. With that, that's all we have today. Again, I'd like to thank you, Malcolm, for joining me on this webinar. Your insight has been extremely helpful and I think valuable for our listeners.
Happy to help.
And for those of you who'd like to get in touch with me, I've left my Calendly link, my email address in the chat. So please don't hesitate to get in touch with me. I'd be happy to talk with you and help you move through the application process. So with that, take care and God bless you. Goodbye.